Hello everyone, my name is Nasim. Greetings from Portugal. I'm going to present the paper Adoption of Precision Medicine, Limitations and Considerations. This paper is prepared under the supervision of Professor Dr. Manuel Santos from Algorithm Research Center, University of Minho in Portugal. Over the period of time, I will explain the main objective, the definition of precision medicine, the theories we use to address the successful indicators of employing precision medicine in healthcare, psychotechnical and diffusion of innovations. I will explain the barriers and limitations for adopting precision medicine, which is categorized in three main classes: healthcare characteristics, precision medicine, and research and practice. I will explain the examination, the results of examining the theories and the findings we presented in this paper. And this presentation will be finished throughout the short conclusion. Why precision medicine? Failure of symptom-based clinical decision-making, which resulted in poor quality of health services, and availability of healthcare big data, which challenge the limited human cognitive for timely decision-making, and also the availability of technical advancements such as business analytics and artificial intelligence pioneered the transition from one-size-fits-all business model to patients like me for releasing the right medicine for the right person with the right dose at the right time. Precision medicine, initiated by the former President of United States, Barack Obama, in 2015 as a promising advancement to impact automated medical decision-making. According to the U.S. National Library of Medicine, precision medicine is an emerging approach for disease treatment and prevention that takes into account individual variability in genes, environment, and lifestyle for each person. For precision medicine to be able to be adopted in healthcare, the incorporation of various heterogeneous parameters is required. Also, there are many researchers all over the world, such as all of us research, to provide innovational opportunities for addressing limitations and barriers of adopting such solution in healthcare. Still, there has not been a clear protocol and business model for emerging precision medicine in healthcare. We are going to use two theories, diffusion of innovation and psychotechnical, in order to identify the most critical success indicator for implementation of precision medicine in healthcare. According to the psychotechnical theory, there are two major aspects for achieving the successful adoption: social aspect and theoretical aspect. Social aspects includes people and organizational structures about skills, education, value and willingness of the employees, attitude and needs. Technological aspects, it's about technology and tasks, it's about tools and devices. And the balance between two tasks, between two aspects are very critical for successful information system adoption. According to diffusion of innovation theory, compatibility of the technology, the level of complexity, how it's hard to understand, the observability, what is the advantage, tangible advantage of adopting that type of technology, triability, and also organizational and managerial factors, all are effective for diffusion of technology in domain. Back to healthcare domain, we categorize the main barriers and challenges in three major categories: healthcare characteristics, precision medicine itself, and research and practice. Healthcare characteristics, for example, about healthcare data, handling big data in terms of storage management, features of data, ethical and privacy issues of data, data integration, such as integrating genomic in electronic health records, or the standards, or adopting the standards of open data in healthcare. Precision medicine also itself as a technology carries some limitations. For example, lack of unique definition of precision medicine, a lack of evidences and valid practical experience about precision medicine in healthcare, and also research and practice when there is less experience of using technologies such as AI and machine learning in order to integrate precision medicine in healthcare, or the limitations about disease classification, also patient segmentation that we will review shortly each one. In terms of data processing and handling big data, the speed of generating a massive amount of data from various resources has not been balanced with the big data management. In fact, the analysis of processing such data is beyond the local infrastructure of many small laboratories, and computational resources and related facilities require high cost and high cost of maintenance and development. So the solutions are offered to manage such limitations. Scale-out computing, for example, this technology, for example, Siemens Healthcare and Philips Healthcare are two companies that provide a health cloud ecosystem in the name of all in one health cloud to manage the challenges and limitations about the storage management. But still there is limitations regarding the privacy and protection of data on cloud. In order to address this challenge, there are a couple of solutions, such as, for example, using access control, but still access control is less effective against internal risk attack. So maybe using some hybrid solution like encryption can be helpful, but also other technologies such as blockchain can be supportive. Blockchain is a technology that with high security, in fact, the possibility to delete or modify stored data is realized, it's almost zero. However, there is a challenge about the regulation of personal data privacy. For example, if the patient wants to delete the data, so this platform also face some challenges and limitation, which needs to have some restructuring in terms of policies and regulations. Another challenge is about the future of healthcare data itself. So healthcare data includes electronic health record, which includes structured and unstructured data, and also big omic, both data, EHRs, records, and big omic data. They are those data are challenging for analytics because of the data frequency, the quality and dimensionality, and also heterogeneity of data. In terms of ethical and legal literature, personal data is very sensitive, it's valuable, and studies shows that this data is 200% more likely to experience a data breach than other industries. So data protection and ethical issues are important. So for adopting precision medicine in healthcare, this regulation and policies need to be restructured. From one hand, the security of data is important. From other hand, the ethical considerations prevents the open data exchange, which should be taken into consideration. And also emerging the precision medicine in healthcare is changing the flow of the power from care provider to patients. So patients have more valid roles in terms of ownership of the data. So one solution can tackle these limitations, inviting the patients as a co-researcher and respecting to the ownership of patients for the data. Another important challenge is about adoption of genomic in HR. Finding the most suitable method for storing and reprocessing genomic and genetic data associated in individual health record is a challenge, because the size of such data, for example, genetic results, is not fit with the current structure and design of EHR system. This point is a major limitation for integrating genomic in healthcare data. And also genetic and genomic data needs interpretation when it's going to be integrated with EHR system. So in many cases, rule-based decision support system or visualization can be effective, but still the limitation is there. And also, again, about privacy of data. So privacy and security of genomic data, it's an important issue which needs new policies and regulations. Adoption of classification system and clinical terminologies also is another point. Lack of nationwide projects and less completed projects of implementing ontology-based terminologies, or a resistance of stakeholders for projecting ontology-based terminologies is another challenge. Lack of experts in biological ontologies and also semantic web, or the architecture to fully integrate and adopt the different type of ontology system and terminologies are still immature. Adoption of standards for clinical data exchange, availability of multi-structured data and related challenges of adopting the existing standards for data exchange. In fact, the standards are there, but the integration of standards into the EMR or EHR records is a problem. So sometimes the protocols are different for interoperability. For example, differences between lab code system and identifications, or missing the genetic information in EHR record. Another issue is about cooperation of stakeholders to educate and to invite potential adopters for understanding and using the existing standard is a limitation. In terms of research and practice, three main categories really needs more research and practice. In terms of patient classification, because of the high patient variability for disease, so validating the patient classification based on electronic healthcare record mining is important, and this part needs more attention in terms of research and practice. Or the second category is about disease classification. So many subgroups of disease have not been identified yet. So the architecture to fully integrate different type of ontology and clinical terminology is not mature yet. And also using the advanced technologies such as machine learning algorithm and business analytics in healthcare for integrating precision medicine in healthcare has less experience. So using those, in fact, selecting the most important or the most suitable and fitted technology for achieving the success needs more research and practice. So to address this type of limitation, maybe developing a secure research-based framework to minimize the oscillation between scholar platform and clinical data can be helpful, where patients cooperate with such arrangement as a co-researcher. Uh, Precision medicine application as a technology or innovation also needs more attention to solve the limitation and challenges. Precision medicine itself, there is a lack of a unique definition for precision medicine. So the terminology is still evolving. In literature, sometimes precision medicine is defined as a, for example, P4 medicine, preventive, predictive, participatory, and personalized. So the lack of the unique terminology or the fashionable terms may lead to misunderstanding by stakeholders who are responsible and has power to accelerate the PM adoption. Also, clinical evidence. Yeah, the lack of clinical evidence or successful implementation of precision medicine is another limitation. Still, there is no valid and extra clinical evidence for integrating precision medicine in healthcare. So this part also needs more research and practice. Considering two theories that we discussed, diffusion of innovation and psychotech, and also those challenges that we discussed in terms of the characteristic of the domain and the precision medicine and research and practice. We examined those theories on those subject outlines that we discussed. So as you can see, adoption of classification and terminology, limitations in clinical evidence, adoption of standards, data processing and storage management, the security and ethical issues, feature of healthcare data, adoption of genomic in HR, selecting the most effective approaches and techniques, patient segmentation, disease segmentations, or lack of unique definition. These are all mostly related to the characteristics of domain itself and also research and practice. We found two major gaps with combining these two theories. As you can see, the latest item is about management aspects, educational, communication, environmental pressure. Those are covered by diffusion of innovation and psychotech. However, the most important factors, which is about research and practice and characteristics of domain, are missed in these both theories. So this is our founding, which integrating the precision medicine in healthcare needs to take into the account research and practice and characteristics of the domain that we discussed about the details. In conclusion, as we discussed, precision medicine is explained as a new approach in clinical decision making to improve the quality of health service, minimizing medical errors and save more lives. To highlight the success indicator of projecting PM, we use two important information system theories such as psychotech and diffusion of innovation. We examine both theories and we identify a precision medicine application as a psychotech and diffusion of innovation phenomena. So in order to, in addition to organizational and social and technical aspects which are covered by both theories, we identify healthcare domain characteristics and also precision medicine in terms of research and practice related to that innovation, which needs also attention for a successful implementation of precision medicine applications in healthcare. I finished my presentation and thank you very much for this opportunity, and I'm available for any questions. Thank you very much.